Sanbonani, it's me, Dr. Fez, once again on another episode of Medshield Movement Connect show, and we're going to be talking about reproductive health. Now, there's generally a lot of information out there as to how you can be safe or how you can fall pregnant, and it can be a bit overwhelming. Today, we're going to be talking to a gynaecologist, and she's going to illuminate the topic, Dr. Lubelwana. As a doctor, I've always believed that good health isn't just about treating illness. It's about empowering people to live healthier, fuller lives. And through Medshield Connect, we're doing just that. This podcast helps you connect the dots between fitness, nutrition, mental well-being, and medical breakthroughs. We sit down with industry experts, thought leaders, and real people to unpack the many facets of health, giving you the knowledge and tools to make informed choices. Brought to you by Medshield, your trusted medical aid partner for life. Well, Doc, thank you so much for joining me today. I'm very excited, always wanting to be enlightened around reproductive health, especially because, I'm reasonably young. I still want to potentially have kids.
Yeah.
So thank you for sitting down.
Thank you for having me.
Now, the age thing is always such an interesting discussion because I think we live in a time where a lot of people are thinking, you know what, I can have children at a later age. Serena Williams was able to have kids at a later age. Things are being pushed forward a lot more. In your experience, when would you say are the key age points for trying to conceive and kind of wanting to have kids, if you had to give an idea roughly?
Okay. So without any interventions, the peak age that you are most fertile, if I can put it that way, is up to age 30.
Wow.
Right? Without any intervention.
Sure.
And then from age 30, you start to get a decline in terms of your ovarian reserve. You hit age 35, that decline gets even quicker.
Yeah.
It goes even quicker in 40 and so forth and so forth.
Sure.
So the best time really is up to age 30.
Age 30.
But having said that, there are ways now of sort of cheating the system, if I can put it that way.
This is why everybody's kind of viewing, because I think we know some of these parameters. I also know at kind of 35, people start going, okay, you can also have abnormalities potentially if you fall pregnant. But I'm also wanting to know, like, what's happening with the technology? What are some of the things that we're doing to cheat the system?
Yeah. So we can freeze our eggs now so that we keep them at that age. They don't multiply when you are freezing them. They stay the way that they're supposed to be.
Yeah.
Whereas what happens with aging is with the change in the DNA and, multiplication and all that, that's when you can have an effect on DNA, on mutations, and then it increases your risk of having chromosomal abnormalities on the babies. Yeah.
Of course, yeah, no, I know that. I think that's why 35 is always in my mind, where they go, trisomy 13, these kind of discussions need to be had. But it's also great that we have these options in this day and age. But before we even start talking about those options, let's kind of go back and talk about some of the things that might affect you when it comes to wanting to conceive. If I'm a young, kind of strong male who's wanting to try conceive with my partner, what are some of the lifestyle kind of movements that you'd want me to have to optimize my chances of falling pregnant? And when should I kind of see somebody if I'm not able to conceive? What's the time period?
Okay. Firstly, I'd like to just back up a bit in terms of the lifestyle things that you can do to improve your fertility. Age is generally considered a non-modifiable factor.
Yes, I know that one.
That's only numeric age. Metabolic age is modifiable by these lifestyle choices that we're going to talk about. So you can modify it using what you eat, what you do, how you take care of yourself, and so forth and so forth. So as much as the number, you can't modify it because you add the year every year. But in terms of how your body functions, you can alter it. You can stop some things from happening much quicker. Even the reduction in the ovarian reserve, you can somewhat, slow it down by how you carry yourself, what you eat, what you put in your mouth. We'll get into it as we talk into.
That's almost like the biohacking, or kind of that's kind of a biohack, being aware of what you're eating and kind of movement. So, what are the recommendations you'd give to people who wanted to biohack, try to optimize kind of their health so they can best, hopefully, fall pregnant?
Yeah. So, firstly, it's nothing new. It's the stuff that we all know, we all talk about.
And please look right at them at home, because I say this time and time again, but I love it when a reputable source says it.
Yeah. So, like I said, it's stuff that we know. Firstly, it's exercise. Mm-hmm. We always recommend that you exercise, but everything must be done in moderation, because you don't also want to over-exercise.
That's true.
You exercise to the point where your body is functioning appropriately. And there's a type of exercise for everybody. So if you don't like weights, if you don't like aerobics, there's always going to be something that you will like. So just try things out until you find something that suits you. And at least 3 to 5 days a week. So that's regular exercise. Important. What you put in your mouth is also important in terms of your diet. So specifically for women, as a gynae, that's where I focus on, obviously. Eating plain yogurt is always a winner. It's good for your health. It's good for your vaginal health as well. It minimizes the risk of you getting candida. It just ensures that your vaginal health stays the way it's supposed to stay. So, yeah.
It's amazing.
Yeah.
And I think it is so important to, before we even start talking about all the fancy kind of treatment or management or taking these supplements, to just hit the baseline things that are going to allow your body to function as it's supposed to. And it's I think one of the, and the reason why I said you need to tell them is because every time we have a specialist come in, that is always the baseline of communication. Make sure you're moving, make sure you're eating adequately and appropriately, and water.
Yeah.
That's what's going to make your body hit that homeostasis and also even optimize itself in many cases.
Absolutely.
Now, when we are talking about kind of trying to attempt to fall pregnant, there are unfortunately cases where people aren't able to. So when do you start having to seek help? How long, how frequently do we have to be attempting to be trying to fall pregnant for me to maybe come and see you?
So the cues are actually from much early on. I always say to people, the moment a girl starts to go on her period, she needs to see a gynae.
Wow.
Because that's where she's going to get to understand what things she should look out for, what is normal and what is abnormal. Because your menstrual cycle is actually what will tell you about your fertility in the long run. True. So the sooner you get to understand, the sooner you get to know what your cycle is like, the easier it is for you in the long run. It's not to say that as a teenager we're looking to help you fall pregnant, but we want you to have good reproductive health, so that when you want to start a family, everything is already, set. So your menstrual cycle is always key. Understanding it, knowing your cycle, so that when you pick up that there's something different, there's something that is out of the ordinary, then you can quickly go and see a doctor and then you can get help. Otherwise, in terms of fertility or infertility, we define it as infertility once you have been trying with the same partner, having had regular intercourse for a year.
Yeah.
And there hasn't been any conception. If you are over the age of 35, we don't really wait until that year is complete, because obviously
time.
Yeah.
Yeah.
So generally we'll start investigating from 6 months at that point. Yeah.
Oh.
So yeah, that's the sort of guidelines.
It's so funny because it's become such an important thing to make sure you're establishing a rapport nowadays, especially with a health practitioner. And you're right, when your cycle, your period starts, it's important for you to understand what's normal, what potentially pain that you shouldn't be having, because I think a lot of cases where people would have endometriosis or all of these other things, they just see as normal because that's just always been the case.
Yeah.
And for you to have somebody to let you know if this is baseline or if you're actually suffering has become a lot more apparent. I think even in practice, hearing colleagues talking about it.
Yeah.
Yeah, it's
so the menstrual cycle is your baseline. It will give you, the cues as to what is wrong. When you know your period, when you know your cycle, and you know what's happening throughout the 4 phases of your cycle, then it makes it easy for diagnosis to be made early and then for treatment to be instituted early.
Definitely. So, and in the cases of kind of the menstrual cycle as a baseline, how would you describe, because I've also worked with colleagues who talked about endometriosis or kind of dysmenorrhagia. There's all of these terms that are there, and it's almost difficult for some people to understand if they are suffering with something that needs to have attention. Could you, first of all, describe what endometriosis is, and also when you should feel, outside of if you haven't gone and seen somebody when you've started your cycle, where there is a red flag because there's too much pain or it's too heavy a flow?
Okay. So your menstrual cycle, let's start with the number of days.
Let's baseline. I like it. We're starting at the beginning.
So generally for most people, the cycle will be 28 days, right? But it can be anywhere from 21 days to 35 days. So you just need to know what it is for you and what's normal for you. So people who have a 21-day cycle, you'll find that in a 31-day month, they can go twice on their period because their cycle comes back much quicker. Yeah. Whereas a person who's got a 35-day cycle, in a short month like February, they can skip that month. But it's still normal for her if she knows what her cycle is. Yeah? So that's why it's important for you to know and understand what your cycle is like. And that's the other thing also people confuse. When we talk about a cycle, we're talking about from day 1 of your menstruation to the day before your next cycle begins. Yeah. So that's your cycle, not the menstruation days. Menstruation days is just one of the phases of your cycle.
Yeah.
So talking about now the menstruation days, on average, it will be between 2 and 7 days for most people. If it's over 8 days, then that's abnormal. If it's a day or less, that's also abnormal.
Normal.
Yeah, because generally it will be 2 to 7 days. And then the flow that you have, you should at least be changing. Well, now we have a variety of menstrual products,
Yes.
But generally, you should have no more than 4 changes of whatever menstrual product you're using. So that's if you're using a tampon, if you're using pads, if you're using menstrual cup or discs, those people will probably change less because they are, for the average flow, those products can last up to 12 hours.
Sure.
So that should be about two changes.
Yeah.
So that's the menstruation phase. And then, the other phases, you just need to know and understand how you are feeling
during those phases.
During those other phases.
It also helps if you have friends and family to also, they know and they can accommodate.
Exactly. Actually, that's brilliant.
Collaboration.
I have 2 daughters, and one of them, just before her period, is not the nicest person.
Understandably so.
And so I've taught them that so that we don't worry what's going on with you, rather I've introduced something that I call, so I used to be a soccer fundi, and I introduced something called a red card system.
Okay. Yeah, the system. I actually feel like this might be good for everybody at home to incorporate red card system.
So red card system, when you are feeling like you don't want to talk to anybody, you just want to sit by yourself, you don't want to engage in any physical activity, like you just don't want conversation and you don't want anybody asking you, are you okay? What's going on? Why are you so quiet? Just show us the red card. Then we know. Okay.
I actually love that.
Yeah.
I love that because I think especially around discussions around the shedding phase or the phase where there's actual bleeding, people get very... Men also don't know how to handle it. Is it an awkward conversation? I think even for me with the medical background, I tend to be able to speak about it a bit better than most people. But my sister will feel very, very kind of awkward speaking with me and my brother who are doctors. And she'll be like, well, so that takes away the need to vocalize and the awkwardness. And we all understand what that means.
And then the people around you are not worried about what's going on. They're not tiptoeing around you, but they understand exactly what's going on. And then it just makes for easier, family life.
That's a dot. That is a gem of a thing to do. Red card system.
Yeah.
So we've kind of said that 7-day period. I know there are other phases. If you could just name them as well. So
it's the follicular phase, which can take like about 14 days. That's when now after you've shed during menstruation, then the ovary starts to build up again.
Sure.
So the follicles are forming, they're growing. And then after that, it's the ovulation phase. Ovulation phase, it's the best phase ever.
Yeah.
But the shortest phase as well. It's like 4 to 5 days. Yeah. But during ovulation, you are feeling your best. You
Strong,
have energy. And also when you are trying to fall pregnant, that is the time to mark. Because your body is just ready to receive. Your body is ready for that conception. You'll find that you are you're happy during the phase, during ovulation. You're easygoing. If your partner says, let's go out for dinner, you're like, sure thing, let's go, If your friends say, let's go to a movie, everything is just like flowing and your body is the same as well.
Okay.
So you'll note that phase with a thin, clear mucus that is released from the cervix, so vaginally.
Okay.
You'll notice that you'll have a lot of that fluid. So that fluid is to make it easy for when you come together with your partner for
reception.
Yes, so that the sperm can swim up easily because it's a thin mucoid layer.
Okay.
Some people may even feel that their basal body temperature also, it rises. So some people actually notice it, and some people feel that they have that ovulatory pain as well on the one side, which is where one of the dominant follicle is on. So it will be on either side. It won't generally be on both sides.
That's Mitchell-Schmidt?
Mitchell-Schmidt.
Yes, that's the... I mean, listen, two doctors on the couch, Mitchell-Schmidt. Honestly, that was one of the hardest things to learn when I was going through. I was like, Mitchell-Schmidt. As a Zulu man, I was like, okay, good.
We'll take it.
Yes, I accepted it.
Yeah. So, that is the phase to just make sure that during that time you have an encounter with your partner. If you are living apart, make sure that weekend, during those 4 to 5 days, you get together, you come together so that you capitalize on that time where you are most fertile.
Okay.
And then the last phase will be the luteal phase. Luteal phase, you don't really have energy. You start to get moody. You want to sit on the couch. You just want to read a book and just be by yourself as well. Cuddle, and just enjoy like hot chocolates and whatever makes you tickle, you know. Yeah.
Sure. So then that, of course, then you start again from the beginning at that point, because then you have the shedding, etc.
Yeah.
And so now I know in terms of you want that ovulation phase when you want to really try.
Yeah.
If you are wanting to optimize, because we spoke about live well, drink water, all of these things, sleep, circadian rhythm. But as a woman, what can you do, or what can you eat supplementation-wise, food-wise, that's going to also put you in good stead to potentially have a very good and healthy pregnancy?
Okay. So I always say the moment you think of conception, you must start taking folic acid.
Yeah.
Folic acid, it minimizes the risk of a baby getting neural tube defects, right? So the moment you start thinking, start taking folic acid, because that will help you. It won't necessarily help in terms of improving your chances of conception, but in terms of the big picture, because you want a healthy baby, healthy pregnancy, healthy baby. In terms of supplementation, I mean, people can take whatever supplements that they generally are taking.
Yeah.
Don't want to mention names, otherwise,
Of course,
No.
Supplementation. And generally, I think even when you go from pharmacists to kind of nurses to doulas, there's a quite a strong understanding around supplementation, I've found nowadays. They can point you in the right direction.
Absolutely.
I think the folic acid, from what I've heard from my professors, of course, from you, everybody always says that's key. Always make sure you're taking that, especially if you're even having the thoughts of potentially trying.
Absolutely. And just make sure that if you have any medical conditions, they are under check, right? Because you don't want to go into a pregnancy with complications already. You want to make sure that everything has been optimized. People who are diabetic need to make sure that their sugar control is, for the past 3 months, at least before conception, is perfect. Or near perfect anyway, because that will also reduce the chances of baby getting any abnormalities.
Sure, of course.
Hypertension, epilepsy, any condition,
HIV,
basically,
the whole works.
Everything. You make sure that everything is under control. And then once, obviously, you get into the first trimester, same thing. You continue with your supplementation. You continue with the folic acid. And continue taking good care of yourself as well. And mental health also is very, very important.
Which in this day and age is actually kind of taking over quite a bit, because I think it's been underrepresented for so many years. And I think suffer in silence has always kind of been the idea, or like it's supposed to be this beautiful, like happy time. And if you aren't feeling that, there's something wrong with you. Have you found that shift where you've had a lot more people describing points of feeling low or the changes in their body?
I think people are taking better care of themselves. People are more cognizant of what's happening within themselves and within their lives, and which is good, And also medicine, there's been a shift, because when we studied, we were told that if a woman is on antidepressants or any sort of mental health
illness,
medication, you're supposed to stop taking the medication when you fall pregnant. Now, no, we understand that everybody needs to have a stable mental health. So now the drive is, if you are on antidepressants, you continue taking your antidepressants, but you need to obviously discuss with your doctor, because some are better to use in pregnancy. Some have less risks and less side effects. So it's always better to discuss with your doctor, but you don't stop your medication. Well, let me not prescribe. It's still up to the patient.
Of course.
Before, we used to actually stop. We had that
just carte blanche,
But now it's up to the patient. We discuss, these are the risks, and then it's up to you whether you want to continue or stop. But one thing we focus on is that your mental health matters.
And I think it speaks to how the mother's also getting highlighted. I think sometimes there was almost a loss of the mother, and she was maybe just the carrier of this life, and whatever was necessary for this life to be brought in. And now it's understanding that there are two lives, both are valuable and both need to be looked after. And I think that's the beauty of the awareness we have today. But before we go all the way to 9 months and then deliver, let's talk about family planning. Because when we talk reproductive health, maybe we don't want to fall pregnant. And could you tell me is there a difference with regards to what you would suggest if I was in your practice, if I'm a younger individual who's wanting to go out there and be intimate but not fall pregnant? Am I going with an intrauterine device because I'm younger, or is it that you kind of prescribe oral contraceptives for people who are younger? Is there really not anything that would necessarily tell you to go either way age-wise? What are your parameters around family planning?
Okay, so what guides us into the choice is when you want to have a baby or when you want to start a family. It's if there's any other symptoms as well that you have. So those are mainly, and medical conditions, of course, will guide you in terms of what is appropriate for that patient. For someone who is not looking into falling pregnant for the next 5 to 10 years, intrauterine contraceptive devices are the ones to go to.
Correct.
Someone who does not want anything hormonal, the copper intrauterine device is the perfect one, because it just uses copper to kill off the sperm as it enters. And it also makes your endometrial lining, the lining where implantation will occur, to be an unfriendly.
Yeah, less receptive.
Yes, yeah. On the other hand, Mirena, if the patient is someone who bleeds heavily, then we would rather go for Mirena, because it also helps. Yes, it releases slowly progesterone. And progesterone helps to thin the endometrial layer and keep that bleeding at a much lower sort of rate. Yeah.
Okay. And then, because that one's kind of 5 years, 10 years?
5 to 10 years. But most of us, we remove it in 5 years anyway, because to have a foreign body, for longer than 5 years. But yeah, it can last up to 10 years.
Of course. And then oral contraceptives?
Oral contraceptives. So if a patient has endometriosis or polycystic ovarian syndrome, for example, then those would be the ones that we go for, because it's contraceptive and it also manages the medical condition.
Of course.
Yeah.
Then barrier, of course, is
dual contraception. Yeah. That's what we always say, unless you are trying to fall pregnant at that time and you're in a stable relationship and you've spoken with, your partner. It's a plan for both of you. Yeah.
For both of you.
So we go dual contraception.
Okay, so that's condoms, kind of, as well as the other contraceptive that she might be taking as well.
Yeah. So you mentioned earlier that contraception is also, important to talk about, because just because we have reproductive organs doesn't mean we always want to reproduce. For some people, the choice is, I don't want to have a baby.
Definitely.
So it's always a choice that needs to be respected for both men and women. And no one should be forced into anything that they don't want to go into. So
I agree with you, and I think that's the beauty again with having the options. And dual contraceptives are amazing because it puts the onus on both parties. And I know in cases where people have to have the choice, it's my body, I might carry a child, so I'll make the decision as to whether or not I want that to be now or ever. And I think that's the beauty of it. Absolutely. This is why these kind of conversations are important. Okay.
Injectables are an option as well. Personally, I don't, just for my personal reasons, I don't use them as much. I don't like them. Okay. But that's just personal, yeah.
Okay, no. So many options, because we are in the era of technology and options are very important. Doc, I have to say, the nugget for me, everything's been great, but that red card system... I'm going to be the bastion for the red card system. I'm going to be telling everybody. Yes. Might actually take it across for me and the other hospitals. And this guys, we need, the red card system. And it's been really great just talking about reproductive health, talking about the fact that there are options. But I think most importantly, understanding that your cycle is such a great indicator for your health and your reproductive health, and understanding it puts you in good stead. So, it's been another episode where dots were connected, a card was created, and it's been enlightening all around. Thank you so much. From me, Dr. Fez, I'll see you on the next one.
Your trusted partner for life since 1968.